House, Linda Ball. Good morning to you both.
Good morning.
Morning. So look, we're hearing these record numbers again when it comes to COVID infections. I'm going to go straight in with Jake's question.
Live video called
Get you to both give a view on this.
Latest Pandemic News
Jake
UK
says, why is the news
2022.
record high numbers of cases while the official government website is showing a decrease in infections? Which is correct and which are we supposed to believe? Linda?
Aye.
Well, I think we need to move away from focusing on cases. We've done that so much, haven't we, throughout the pandemic? If you look at the government's daily dashboard, you can see the UK cases are down about 12% actually in the last week, around 70,000 fewer cases, which suggests a different picture from the ONS infection survey, which are the figures you were reporting, where you've got that 1 in 13 people estimated to be infected, I think, up to the end of last week. So you can see there is a real mismatch there with rise from one and a decline in the other. And that's really due to the changes in our testing regimes that have been introduced in recent months. And of course, from today or from yesterday, free tests in England at least no longer being available for for the majority of people. So I think we need to rely more on the population surveys. Those are people who volunteered. We're looking in private residential households, and we know that the ONS infection survey will continue at least for another year. So the cases are not meaningless, but I think if you want to look at something that's more reliable, we need to base it on the population research.
Chris, what are your thoughts at the moment?
If you look at that government COVID summary page, you'll see that alongside the graph that shows how many positives are being detected, there's also a graph that shows how many tests are being carried out. Those are absolute numbers, not a rate. And so when you do fewer tests, you get fewer positives, and the tests have gone down, so the number of positives being picked up has gone down. And that's where the ONS data can fill in the gap, because that is a rate. It's telling you how many people across the population as a whole, based on a big representative survey sample, there are in the country. So on the one hand, you're measuring absolute numbers of tests that are done and how many positives they're returning, but the other data are showing you what the actual rate is when you extrapolate that across the country. And that's why there's that apparent disparity.
Linda, pick up on this one for you. We mentioned it a couple of times this morning. Today, Saturday, is the first time that children aged 5 to 11 in England can get the COVID-19 vaccination. So just talk us through that process, the decisions that's been taken, and in practice, what it means for families.
Charlie, so this is an important development. These younger children, 5 to 11-year-olds, if we go back to the beginning of the process, there was a trial done by Pfizer with a low-dose vaccine, several thousand children involved in that. And what they found, they were looking mostly at safety as well as effectiveness, and they found that there were very, very few adverse events in young children. They tolerated the vaccine well, and also that it provided protection, particularly against severe disease, which of course is what the vaccines are primarily aimed to do. So speed ahead to roll out. Many countries were ahead of us in this, the US in particular, but some countries in Europe, Canada, Australia, etc., delivering now vaccines to millions of young children around the world. And those data are also really important because they give us more insight on safety in the real world. And again, they're very, very reassuring. So now in the UK, the decision taken by the MHRA, first of all, to approve the vaccine, and then secondly, the JCVI to say that children could have it. And we already started here in Scotland. The program is going well. Of course, it's a choice for the child and the parent, a discussion to be had. There's lots of really good information. But I think why it's important now is if we look ahead, if we have new variants or we have future ways of infection, it means that young children will have some protection, and that can't eliminate the risk of infection. And even though the risk of severe illness in children is very low, it will protect the children who may be most at risk. Of course, the most vulnerable are already been eligible. So it's good news, and I hope people can discuss it in families and make an informed choice themselves.
Chris, a thought for you now, and I'll give you the question in a second. The gist of it is, why are some people not catching COVID? And Tom has an interesting question in relation to this one, who says, I'm a nurse frequently working with COVID patients, yet I've never tested positive and still have negative antibodies. Are there any studies looking into why certain people at continuous high risk of exposure do not seem to contract coronavirus?
Well, I don't think anyone's looked specifically at healthcare workers, but they have looked at people who are household contacts. We can look to the study that was done about 2 months ago by researchers at Imperial College, because they wondered about the question, well, why is it that we've got people who live together, and we know that the vast majority of transmission events when we get cases of coronavirus stem from people catching it from the same house, although only about 20 or 30% of the time. Why is it that you've got people living together and therefore sharing air, sharing food, sharing time, possibly even sharing a bed together, but they're not catching each other's coronaviruses more than about 30% of the time? Why is that? When they took blood samples from the people who weren't catching coronavirus and compared it to people who were, there are antibodies and white blood cells in people who are not catching coronavirus that have been made in response to other members of the coronavirus family, because it's a big family of viruses that all look a bit similar but are distinct in their own rights. And if you've caught another member of the family, you can make an immune response that's sufficiently broad that it also protects you against coronavirus of the COVID type. I suppose a really good analogy is to think of what Edward Jenner did a few hundred years ago to conquer the smallpox problem. By making the observation, people who have caught cowpox, and if you give cowpox infection, a related virus but not the same as smallpox, to somebody, they don't become very ill, but they do develop lifelong immunity to smallpox. It's sort of similar. If people have caught other members of the coronavirus family, which cause common colds, there in some people is enough response to give them protection against COVID. And why this matters isn't just that it's great news for the handful of people who are in that position, it may be more than a handful, but it also says we might be able to find out what it is about certain coronaviruses and certain people that mean they make that kind of response, and that would enable us to make a pan-coronavirus vaccine, in other words, a one-size-fits-all vaccine, so that you would defend people against variants that don't even exist yet.
Fascinating.
And that's what researchers are now working on.
Linda, I mean, perhaps you want to pick up on that, because we're seeing these record rates, but people, I mean, anecdotally are just saying, I haven't got it. Am I just immune to it? Because everyone seems to be getting it now.
I think most people are going to pick up this virus probably several times in their lifetime. We need to recognize we don't have what we call a sterilizing vaccine, which would prevent infection. So we're going to be living alongside it. But I completely agree with everything Chris has said. And we will find out more about that in future. The other thing, something we've looked at in my own studies on different topics, is what we call the ACE2 receptor, which is a protein, and that's how the spike protein from the virus enters into our cells. That's one way in, if you will. And we know that the expression of that receptor is different in children, which might be why they are less likely to have symptomatic disease. And some people seem to respond differently. So there are studies looking at this. And just on healthcare workers have been fantastic all the way through the pandemic. We've got some big studies in the UK, including Siren, that even though it's not focusing on this specifically, is giving us a lot of information from the groups who, as Tom's asking this question, are probably the most exposed. So we need to let science do its work, but it's a really, really interesting question.
Yeah, it really is. Nick's asking, he says, I've had COVID now for 8 days. My wife has now tested positive. Will my recovery be delayed now? I mean, Linda, this comes down to rules, but also the science behind that too.
That's right. I mean, I think it's, as Chris is saying, we don't know what the relationship might be between different people in the household. But I think the guidance is changing, and let me just focus on that because I think it's important that everyone's clear on that. If you are interested, you can go onto the gov.uk website and see the new advice about people who not only have symptoms of COVID, but other respiratory viruses, with free testing ending in England. And it means if people particularly have a high fever or are feeling unwell, even if they don't know that it's COVID, they should still try and isolate. And that recommended period is 5 days. So that's what we're looking at. It's actually just 3 days for children who are less likely to pass it on for a longer period when they're symptomatic. So that guidance is changing. But I hope, even though we might have more than one person in the household who's infected, that people will still be able to recover. And of course, the key to that is to continue to take up the vaccines, which is what's protecting so many of us from becoming severely unwell.
Now, Chris, you want to pick up on that issue of the vaccines? Because I'm just looking at some of the comments of Professor Sir Jonathan Van Tam, of course, who became very, very highly respected. Someone people really listen to a lot. He is now, of course, no longer England's Deputy Chief Medical Officer, as was. But he was reflecting on his thoughts and worrying about, in his words, I'll quote, case rates in over 75s becoming exceptionally high again. Case rates generally. And he was saying he has sleepless nights, keeps him up at night, the worry about those older age people and those who have weakened immune
I bet it
systems,
does.
that they do go and get a booster jab. Just talk us through the concern that some people just might not bother. They think we've done as much as we've been asked to, we're not going to get a booster. Why bother?
Indeed. Just on the previous point, the gentleman wants to know, is his recovery going to be delayed by the fact his wife has now got the virus?
Yeah.
It shouldn't do. If he's getting better, then he should get better at the same trajectory anyway. The fact there's another household contact with it, it won't set him back. He should be just recovering at the normal trajectory. On Jonathan Van Tam's point, we don't know at the moment what people's immunity is doing. And we're confronted by a range of different moving targets. The virus is a moving target. We had Omicron, then we got spin-off variant of Omicron called BA2. And that's now causing most of the cases in the country. And it's probably more infectious than Omicron. We've got a range of vaccine uptake rates across a range of different age bands in the country. And we've got a range of different times at which people in different age groups got vaccinated first. Therefore, we have different amounts of elapsed time and different amounts of loss of immunity with time in those different age groups. The people who were prioritised were the older people and the most vulnerable first for both vaccination and for boosting. So the argument goes that because immunity does wane with time, at least a bit, in the average person, the people who are likely to be the most vulnerable to catching the infection and catching it more seriously, if they're going to, are going to be the people who got vaccinated first, boosted first, and are in those risk groups. So it makes sense to argue to that, or to advise those people, given the opportunity, please go and get a booster, because this will top up your immunity. We don't know for sure that actually your immunity
Already have done.
waned. We don't know you're at enhanced risk, but you may well be. So as a cautionary measure, you should please go and get one of those boosters. Now it's being offered.
For my fourth booster.
Chris, Linda, thank you both so much. It feels like we're friends. We have actually met because we had you in the studio last year. But I want to finish with an email from a viewer in Northampton, just a thought, who says, I've worked in microbiology for 40 years and look forward to every Saturday to Linda and Chris's up-to-date information on COVID. So there's a thank you for you both. Take care.
If you like this video, please subscribe to my channel, Sign James, on the 4 speed videos. Quite a passport, the knees, so many, outweighing you. Subscribe to my channel, I'm Sign James. Bye.